Hi, hello, this is Dr. Ashok from International Center of Sexology Research and Development, HANUMAN Junction, KRISHNA District, Andhra Pradesh, India. Let us see the psychosexual development in human beings. Sexuality is the most integral part of every human being. Sexuality is a dimension of personality and it is present from birth to death. From the time of birth, when sex assignment is made as a boy or a girl, sexuality is shaped differently depending on the gender, by parents, teachers, friends, and society. Hence, psychosexual development occurs from the time of birth up to the adult stage. Though every person is sexual, each one's sexual expression is different because it comes from personal experience and social sources. Journey through life is characterized by physical growth, emotional changes, and social interaction with familial, cultural, and societal influences. Hence, sexual development expressions and needs start developing right from a young age. Let's see childhood sexuality. Childhood is seen as a stage of asexual period. Many are of the opinion that childhood is devoid of sexuality. According to Masters and Johnson, childhood has been called the last frontier in sex research because it is difficult to study by interviewing children and also because there will be understandably an objection or protest from elders. When adults are interviewed about their childhood, authentic information may not be obtained, but most of the studies on childhood sexuality have been carried retrospectively. But many studies have been made on child sex abuse after 1970s. Many believe that childhood is a period of sexual innocence. The fact is that children do not attach same importance to sexual events as does the adults. Sexual behavior is slowly acquired by learning and conditioning. Gender identity, sexual words, modesty, family role, gender role, self concepts, sexual messages through mass media, sexual values, and sexual orientation slowly develop in an individual until he attains adult sexual lifestyle. Let's see sexual reflexes in infancy. It has been observed that there are reflex erections in male babies even in intrauterine period. Newborn babies also can have erections and girl babies can have vaginal lubrication. Initial period of parent-child bonding with feeding, caring, hugging, kissing, bathing, etc. will have a positive influence on the child's capacity for forming intimate relationships in the later life. A child deprived of love, affection, and bonding can develop various psychosexual problems later in life. The infancy and childhood sexual reflexes cannot be termed as erotic. The infant and child perceive the responses as pleasurable only. But children can develop positive or negative attitude towards such responses depending on parents' behavior, their approval or rejection. Helen Kaplan writes, babies exhibit their joy when their genitals are stimulated. Heredity and environmental factors have an influence on physical growth of the child. By breastfeeding and holding the baby closer, mother-infant bond develops and this gives pleasure and satisfaction and secure feeling to the child. The mouth is richly supplied with nerves and they are very sensitive. Babies also learn through body language and elders' expressions and talks. By age 2, babies develop a sense of being a boy or a girl. Babies also start exploring their body parts. Genital handling is a part of self-exploration and they may also get pleasurable sensation. Parental behavior to the child's handling and genitals can be one of shock, irritation, scolding and teasing, which can also affect the child's attitude towards genitals. But parents have to tactfully teach the socially appropriate behavior to the child so that it can develop proper attitude towards sex and sex organs. Sex negative tones of early childhood messages can have a long term effect on the child's future sexual development. Infants can play with their genitals for the sake of curiosity, pleasure, insecurity, or medical problems of genitals. The dresses, toys, parents' behavior, talks, and actions can teach maleness or femaleness to a child. By age 4, children can start asking questions about body parts, how babies are born, why girls and boys are different, etc. By age 5, children start learning modesty, reduce sex games, and learn values of physical and emotional intimacy. The father of psychology, Freud, introduced psychosexual stages during development of child sexuality. These are oral stage, in which child gets pleasures through mouth. This is seen by breastfeeding, where child gets pleasure by sucking at the breast and oral exploration. And the second one is anal stage. Between 1.5 to 3 years of age, infant gets pleasure from the bowel movements. And the third stage is phallic stage, pleasure by handling of genitals. But this is not the same as adult erotic sexual feelings. And the fourth stage is latency. This is an asexual period till puberty and adolescence. But many discredit this and observe that sexual play and experimentation continues even in late childhood. Freud also describes penis envy, Oedipus complex, Electra complex, and repression. Child should not be made to feel guilty or sinful about genital handling. Genital hygiene, acceptance, and respect of body parts to be taught to avoid lifting of skirts, pulling down pants, etc. Proper behavior should be taught to children. Sexual abuse of children is very common. Children have to be taught about how to protect themselves. For a healthy psychosexual development, matter of fact approach, healthy sexuality education, which is age appropriate, will help. It is also important to use proper terminology for body parts and genital organs. Let's see how psychosexual development works in late childhood. Children gradually form peer groups and start socializing. The growth rate varies from one child to the other. They explore each other's bodies, talk about sexual matters. Gender role stereotyping starts developing. Children should start getting sexuality education regarding puberty, adolescence, values, emotions, and social behavior. Parents have to be good role models and take part in discussions about healthy sexuality. Thank you. Your Dr. Ashok.